Hi everyone, Joel here with you. Yesterday when I did the weather, I said I was going to do a virus update, but quite frankly, I just got a little bit depressed about the way things were blowing up, so I wanted to wait until this morning so I could get all my facts and figures right. And now I have them. As you can see, 5:03 11 seconds a.m. this morning, the 6th day of March 2020. It is Friday, and our map looks quite different now. I had visions of what I told you guys in the live show the other day. One day we were going to look at this map and things were going to start to blow up. Grant you, we are still not like other countries, especially China, Iran, Italy, South Korea, but we're working towards it. This is not fear. This is just to make you guys wake up just a little bit. When I give you these facts and figures, you're going to see what I'm saying. There's more in Florida. There's more new cases. It's in Colorado. It's in Maryland, close to Washington, D.C. I wonder how much we're going to see President Trump out and about. I hope he doesn't touch his face because it's there. More cases in many places. So, let's just click on the U.S. I'm just going to cover the U.S. right now because this is where I have all my facts and figures down. But the breakouts, I do want you to see. There's many more in Africa, South Africa, 1, 2, 3, 4, 5, 6, 7, 8. The bigger the dot, the more cases it is. You can see it's everywhere, folks. My goodness, look, I do want to point this out. Look, in Iceland, there's 34 cases. How in the world did it get up there? Do you think those people's been going to China that much? Well, we're going to blow the map up, and I want to tell you that this map, whenever you have a case break out in your state, and you think it's close to you, maybe, but you're not sure, and you really want to find out, well, I'll show you a little trick, okay? We're going to take Atlanta, Georgia, for example. Now, when we look at this map, it says there's 2. These are in Fulton County. So just make the map a little bigger. Now, what you got to do is remember where your dot is, because when we make this map bigger and bigger, as you can see, that dot moves off downtown Atlanta. See how it's moving? And you can find out exactly about the area that these patients or patient may be. Now, it was right around in here. Let's bring it down one time. See if it'll show up. There it is right there. We've got our area now we know to look for right around in this area. Okay? So as we keep making it bigger and bigger, we know it's in this area. It's not exactly in Atlanta. As you can tell, it's in Fulton County. But it's right up in this area. If you live in this area right here in these counties, you would be able to see. Now, this is a larger city, Atlanta, of course. It's not going to tell you an exact thing, but I have looked at some places that brings it right down to the street name. So if you want to see if any of this is closer to you in your areas, that is how you can do it. Now, before I punch these dots, listen to this, folks. I keep a track of what's going on with this. Pretty much every time it updates, I write it down and the time. Do you guys realize that Monday, this past Monday, we only had 89 confirmed cases? As of now, there's 233. Well, that means since Monday, and it's very early on Friday morning, we have had 144 cases to show up. That's a big jump, huh? Yesterday, we started with 159 cases at 8:50. And by 6 p.m., we had 222. So it only took 9 hours to get 62 more cases. And then overnight, we had 12 more cases. And our total this morning is 233. That's why I dwelled on you guys to prepare when earlier, I talked about this last month, but I really told you guys in the live show I thought it'd only be a few more days. And when I say that, it doesn't necessarily mean you're going to get coronavirus. But what it means is if you need anything, there's not going to be a whole lot of stuff left, folks. So I'm telling you once again, you need to make sure you've got what you need. Or at least try to have what you need. I know it's really hard on a lot of us. We can't get but so much. But whatever you can get, go ahead and get it, because this thing is blowing up. And if you also remember, I said, one night, I hope and pray this doesn't happen. But when we go to bed and get up the next day, this thing could be very much red for the United States. I did some research yesterday. I came across this article from a Chinese scientist. And he is saying that this is what he experienced. It was a Chinese scientist. He is also a doctor. And he says that when it comes to estimating people who have this, that don't show up, and show up at a later date, just, in other words, the cases that haven't been confirmed that probably will be confirmed, he says that to do 10 times the number of confirmed patients. This way, you have a better idea of the ones who have this and are infected with this. Doesn't necessarily mean they're going to come down with it. They could be home quarantined. They may not be. They may get very, very sick. They may not. But they have it. So if we did that this morning, there's probably 2,330 people in the United States alone that has this. And this is just an estimate. And this is the way the Chinese scientists did it. So, now you've got some facts and figures. Let's go over what's happening. Now, when I looked last, you had 4 cases. We'll start down here this morning and see what it's looking like now. We do have this one case up in the Panhandle in Santa Rosa County. That is 1 confirmed. Tampa, I think, had 2 last night. Still got 2, so that's 3. And Sarasota with 1, so that's correct. These are all active patients who have this. This is 4 in Florida this morning. Now, when we come to the Atlanta area, that's what I'm going to call it, we still have this 2 in Fulton County, Georgia. Yesterday, 1 popped up in Tennessee. 1 popped up in Tennessee. This is in Williamson County, Tennessee. This is 1 patient here, and I believe in my state, North Carolina, we still have 1 up around the Raleigh area. That's 1 confirmed. Look, folks, I know for a fact, Jack, we've got many more people in my state being quarantined at home right now. So I really think what the Chinese scientist wrote in his paper is correct. We can say 10 times this 233 and get 2,330 that possibly have this. I think that's a good way to do it, and that's how he was trying to track the ones in his area in China. Now, when we move a little further up north this morning, look here. We have this one that's popped up in Montgomery County, Maryland, and there's 3 that are confirmed in this area. When we come up, we know how New York exploded yesterday, but we're going to make this a little bigger. New Jersey. It started out with 1 yesterday, but right now there's 2 in Bergen County, New Jersey, that are confirmed and active carriers of this disease. When we move down just a hair here, New York City has 4 confirmed, but they've got like 2,700 people under quarantine at this time. But they have 4 confirmed patients at this time. We're going to come over here now to Queens County. There's 1 confirmed. And, of course, when we come to Westchester County, New York, 18 confirmed, 18 active at this time. So, things are exploding in that area. As we move on over now, up a little further north, let's check out Rhode Island, see what their statistics are this morning. They still have 2 that are active. When we come over here, this is Massachusetts. This one is in Norfolk County, Massachusetts. This is 1 confirmed here. When we move over here, we have another one that's confirmed and active in Massachusetts. This one's in Norwell County. Boston itself, it had 1, but the one in Boston itself has recovered as of now. And Middlesex County has 1 active at this time confirmed. This all in Massachusetts. And in New Hampshire, they started out with 1, now they've got 2 confirmed in Grafton County, New Hampshire, that are active at this time. I haven't seen any more up in Maine, none in Maine right now at this time. So we're going to move back on down. We've covered the coast there, starting with Florida, going up and around. We'll make the map a little bit smaller. None right so far that I have seen in the state of Virginia itself, but it's pretty close to Washington right now, in Maryland, right in this area. So you need to watch this area here. None in Kentucky at this time that I've seen. But as we move over this way, looking like Ohio's pretty good with nothing. Michigan, still nothing showing up. And I know good and well there's a lot of people that's being tested or either told to be, self-quarantined. In Chicago this morning, we had 5 confirmed in Cook County. 2 of those have recovered, but there's 3 patients still that are active, and they probably are contagious with this right now in Cook County, Illinois. And in Wisconsin, that one recovered. It was 1, it happened last few weeks ago. That person has recovered at this time. That was in Wisconsin. So now, I think we hit this one here in Tennessee. We're going to go over now to Texas. In Texas, we have more dots. We started out with 1. Day before yesterday, we had another one show up, and now we have another dot. So in Harris County this morning, we've got 2 confirmed that are active. This is in Harris County, Texas. Fort Bend County, 1 confirmed. Fort Bend County, Texas. San Antonio still has its 1. It hasn't recovered as of yet. So, moving on across, now we got 1 in Denver. Oh, not Denver, but Colorado. Not just west of Denver, here in Summit County. We don't have 1, we have 2. We have 2. These are all brand new people. These haven't been showing up. 2 in Summit County, Colorado. Las Vegas, this down in Nevada area. In Clark County, this is 1. This one showed up just yesterday. And in Arizona, we have 1 confirmed. Maricopa County, this is in Arizona. We have 1 active. I believe the one closer to Phoenix has recovered. Yes, it has. This was in Tempe, Arizona. That one's recovered. Still one active in Arizona. As we come over to California, my goodness gracious, look at the red dots. We'll make this a little bigger to ensure we can get every one. San Diego County, 3 confirmed, 1 recovered, 2 active. San Diego County. Orange County, 3 confirmed, 3 active. Los Angeles, 11 confirmed, 11 active. San Benito, California, 2 confirmed, 2 active. Santa Clara, 20 confirmed, 1 recovered, 19 active. San Mateo, 2 confirmed, 2 active. This is California. San Francisco County, 2 confirmed, 2 active. Berkeley, 1 confirmed, 1 active. Contra Costa County, 1 confirmed, 1 active. Sacramento County, 2 confirmed, 2 active. Sonoma County, 1 confirmed, 1 active. Placer County, 2 confirmed, 1 death, and still we have 1 active in that area. Humboldt County, still have that 1 confirmed and 1 active. And I went over that county, so we have covered California as of now. Over in Oregon, Washington County, Oregon, 2 confirmed, 2 active still in that area. And we have another one confirmed in Oregon, 1 confirmed, 1 active. I still think Oregon is in between California and Washington. There could be a lot of traffic going in and out through that state, so Oregon might get many more red dots on it before this is over. Now in Washington State, Grant County, 1 confirmed, 1 active. We'll come over to unassigned location. Now, what this is must be, this is what I'm assuming anyway, this must be where they've taken some patients to recover. It just says an unassigned location of 5 patients confirmed as active. I'm not going to go through the motion of the map, but I showed you what to do. If you make it bigger, you can figure out where it is. As we move up to Snohomish County, Washington State, 18 confirmed, 1 death, 17 are active at this time. And when we come to King County, Washington State, 51 cases confirmed, 10 deaths, 1 recovered, and at this time 40 people are active with this virus. So this is a rundown of what's going on. Early this morning on Friday morning, I will keep my eyes on this, and if I see any more breakouts, I hope this thing slows up, because if it doesn't, folks, it's going to be a mess. And I would suggest, if you're sick, if you just don't feel good, if you think you may have just the flu, don't go to work, don't go to school, and spread. Use your head, call your boss, let them know you're sick. Now look, I know, I have worked sick so many days in my life at my jobs. But don't do it in this case. It's a whole new ballgame, folks. This virus has 2 strands. You all know that. One spreads extremely fast. One is much more potent than the other. I don't have to go into all this stuff. Just stay safe. Please, for goodness sakes, wash your hands. Wash your hands. Many, many times. So we have right now, on this Friday, the 6th of March, 12 deaths. We have 233 confirmed cases that have happened. And out of those, we've only had, out of the 233, 8 that have recovered. So that's a small number if you ask me. That's all I'm going to say. I would like to see that total recovered number like in the hundreds at least, maybe 100, but it's not. It's 8. These are more or less all brand new cases, and they're going to be around for a while, and more spreading is very possible to happen. So that's your virus update right now. Please stay safe. Use your head. Make sure you have good health etiquette and do what you're supposed to. Have a good day, a safe day, a blessed day. I love you all. Thanks for everything you do for me. Peace, love, and kindness to each of you. If you have any kind of information going on about this virus in your areas or something you've seen, maybe gone to the store and seen stuff, or hadn't been able to get stuff, or you're sick and you haven't been tested or anything, please jot me a note. My email address will be below. When you jot that note, give me your phone number. I'll be glad to speak with you and see what's going on. Everybody stay safe, and God bless us all.